My name is Patricia Obichukwu. I'm the founder director of Wellbeing Connect Services. It's a mental health charity based in North London dealing with families. Our special area is advocacy support, but that advocacy support is specialist advocacy support. We offer to families, which at times include child protection issues, mediating with them, between them and the schools and any agencies, and then supporting them within the mental health system. So we are also a voice for the vulnerable. That's why you're hearing my voice.
Have you personally experienced unfair treatment or racism in the country?
Well, of course I had. I was just beginning to tell you. The first time I experienced it was at the Holy Name Roman Catholic Church. But that wasn't racism. I think that was envy. And after we moved from, was it Hugh Mossad, we went to Salford, and this girl in the class, it was a lot of hate in her. And I said, "You don't like me?" She says, "No." And the next thing I know, I think it's the nuns, because it was a Roman Catholic girls' school, picked her out. And all the girls in the class cheered.
There was a time this year, in fact, just before the whole lockdown, where I was actually at work driving with a client, and I was pulled over by the police. And I said to the police, I'm currently at work. I'm with a young person right now because I do mentoring in the community. And they said, well, that doesn't matter. You could still be a drug dealer. And I sort of just paused and said to myself, drug dealer, what do you mean? I'm at work. I showed them my ID to prove that I'm at work. I'm with a young person. They asked us to get out of the car. We'll put in handcuffs. So you can imagine I'm at work. I'm putting handcuffs. My young person's put in handcuffs. They've searched my car. Obviously, they've not found anything. But I found that so embarrassing in terms of, it made me think I'm at work, trying to get on with my job. But even sometimes you could be doing the right thing, but sometimes that doesn't actually, I guess, hide the color of your skin, and that there is a level of racial profiling that happens and takes place in the UK consciously and unconsciously as well sometimes.
Once I was in my French class and there was only 2 black girls in our French class, maybe 3, but I was the only black, pretty much the only black girl in my form class anyways. But in terms of when I was in my French class, there was a group of us, and there was a black girl and about 10 different white boys, and one of them had asked her for a pen, and as she took out the pen, they just laughed to each other, saying, one minute they take out a pen, next minute they're taking out a knife. And there's many other instances of that where that has happened around me, and I've had certain circumstances which have been said to my face, but we move from it,
No.
I work in a predominantly Caucasian environment. I've been working in IT sales for probably the last 8 years. Predominantly when people hear my voice, they won't suspect that I'm from an ethnic background. However, once they meet me in person, that's where I see, or I feel that the atmosphere in the room has completely changed.
Right.
To give you a great example, last year I had a meeting with a very high brand, where you would say that this is probably one of the top 2 brands in the globe, based out in the Netherlands. I flew over the night before, obviously making sure there's no prejudgments about me. I made sure that I had the appropriate dress code on lock. I made sure that I was correct and on time. Okay, when I entered the building, the 2 questions that they asked me at the front of the office was, who do you work for and why are you here? And when I explained to them who I work for and why I'm here, they automatically thought that was incorrect. So instantly I negated, and I asked them, why is that important if I've already told you why I'm here? Why do you need to check my, because they asked me for my ID and my passport. which I gave to him because obviously I was thinking, well, do you know what? It's completely fine. I can understand it being a process if they ask everyone this, but it was only me that was picked on. So when they asked them the questions why it was, they couldn't even give me a great answer or a good reasoning. So that's one reason there. But there's, I mean, that I've felt this prejudgment against ethnic minorities, especially against black men. I felt this in other situations and scenarios.
One of the incidences where somebody called me and
Wow.
which was very embarrassing at work, but I make sure that I didn't leave it lying down the carpet. I have to take it to my manager. So yes, I have experienced it. Apart from being called names, I've been being snobbish, people non-responsive to you just because of your color. Yes, it does exist a lot at workplace.
My name is Ade Adeshina from Obe Community Trust, based in the London Borough of Enfield. And we have been in the borough since 1990, March 1990. Yes, certainly we have experienced inequality, systemic, I will say it again, I'll repeat it, systemic discrimination at a higher level than our other counterparts in the borough. We have experienced it and we've been marginalized. So the structure is there, but there is systemic discrimination within the structure. And if this is not addressed, it's just going to go on and it's going to lead to a place where the African community is going to be demanding their right because we are equally a taxpayer in the borough.
Here in Enfield, Wellbeing Connect Services, which I founded 22 years ago, is the major Black mental health organization. But for years, we have struggled with getting equal allocation of funding. In as much as we provide critical services in the borough, but each time we are given shoestrings to support the communities, which is not even appropriate to pay staff or to do other things, you know. So it is really sad compared with if you are to do impact assessment on the funding allocation in the borough, you will see that Black organizations are least funded in the whole borough. Some of them have come and gone. I've seen many Black organizations come and gone. Many Black organizations that are doing great work that couldn't expand what they're doing or their capacity because they are least funded.
Okay.
So it's really, really very, very saddening. And Black community are overrepresented in mental health institutions.
Our contribution is not valued as it ought to be valued. And the fundings to go with that is not even, it's just non-existent when it comes to African organizations and the Caribbean organization. They're like a piecemeal. Token injection is more all over the place. And the offices and other people within the system are guilty of this. Not the other organization within the borough, because they also are doing their best, the best way they know how. It's the officers and the people at the gatekeeper that needs to know best and do the right thing. And this message, I believe, if it gets to them, they will be searching their conscience. They know it. And the statistics is not easy. It's not something that anyone could just be talking. The statistic is on the Enfield website. It's on the NHS website. Google it, you will see. The other day I Googled one, and I looked back 20 years, and I could not see any African organization or the Caribbean organization receiving above 50,000 from the council. But I could see over 20 of other organizations that are not African or Caribbean receiving well over 200,000 from the council.
So definitely,
the majority that I see were the Africans are 5,000, 1,000, and 10,000 below, piecemeal. So that doesn't even cover rent to the council. If you rent a place from the council, it doesn't even cover rent, let alone cover service delivery.
The property where we're providing these services belongs to the council. And the council will charge you the same commercial rate that others are paying. So they will give you, let's say, for example, they give you 20,000, they take about 14 or 15,000 out of it. By the time they put all other costs, waste, insurance, all of that, the whole money they've given you to provide services is gone.
If police are behind me while I'm driving, I'm always thinking, am I going to get stopped? Am I going to get stopped? And I'm not panicking because I've got anything in my car that I shouldn't have or anything illegal. But I do panic when police are driving behind me. I do panic and I do begin to think to myself, well, I could get stopped now. That's one way I think it's definitely affected me. I think it's increased my paranoia on the street.
In terms of my actual mental health, I wouldn't necessarily say like I was diagnosed with anything, but I did have a lot of anxiety just generally being a participant in my lessons. It really did kind of hold me back. So it definitely did bring those kind of feelings up, but thank God it was nothing which I'd say I was diagnosed.
There's a lot need to be done when it comes to the Black Africans and Caribbean community of this, but there's a lot more need to be done to actually start rising from the arches, let alone to think of meeting their counterparts, other sectors within the borough. They know the statistics, they know the fundings, they know where the fundings are going in the borough. So I don't need to tell them. We have the statistic. It's actually open statistic that is on NF Council website, it's on NHS website, who they fund, where their commissioning goes to. And we've been saying, therefore, why are they not commissioning us? Why are they not funding us adequately enough? But yet, when we say that, we are like a troublemaker.
It's really, really sad what we have been experiencing and what our clients have been experiencing, because some of them have a tendency for suicidal thoughts. Some of them have family issues and challenges with schools for their children and all that. And we also get involved in managing crisis.
We need more places like Wellbeing Connect Services where they can identify with your struggle more, because it's talking to your own people in it. Like other races don't really understand the stuff we're going through because they don't go through it. But people of color go through a lot, and it's good that if you've got somewhere to go to talk about it, like this Wellbeing Connect service, it's good to be able to express how you feel to your own color, people of your own color, because they understand more. So it's a good thing that we've got this. It helps a lot.
Well, I'd like to say, coming to Wellbeing Connect Services, Ebony's people, it's been a great help to me, yeah.
If I have a magic wand, I tell them fund us properly. I tell the council treat us equally. I tell the CCG to ensure that the funding goes to us so that we can continue to provide the quality services we're providing. You know, some of the mainstream services that are being provided, you know, the Black community are not accessing it. So I believe that we have the key. We have the key to our community. We have the key to carry our community to the mainstream. That is why we are bridge builders. So they will benefit a lot by investing in organizations like us.
Well, I do hope you enjoy this presentation, which is put together by Wellbeing Connect, an NGO, a charitable status organization, rendering services to the Black and ethnic communities, especially in the north part of London.